Stand by SOT1.
Standing.
10 seconds. Ready, roll in. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It's January 21st, 2022. A minute after 12 noon. Welcome to another edition of Work Comp Matters. We are sponsored by mancavepodcasting.com. We have over 600 podcasts in the tank, in the cloud, completely free, no obligation. They're available to you 24/7. And if you want to do your own podcast, all you have to do is talk anywhere in the world. All you need is a smartphone or a computer. We will go ahead and manage, produce, direct, get that sucker streamed live, and then into the cloud forever, all for a very small fee, 818-357-4120. Good afternoon, everybody. My name is Steve Appel. I'm joined by the madman across the water, the socialist voice of reason, Mr. John Scalia. And before we get, just Scott, note to Scott, I'm not showing that at least I was beeped here that the show was going on, but I'm sure that the show is going on. But if you could just check into that, I appreciate it. Good afternoon, everybody. It's a pleasure to be with you on Friday. John and I have stories that we believe are of interest to you California employers, employees, and of course, we haven't forgotten about you damn independent contractors. Patient beware, some states still pushing ineffective COVID antibody treatments. Also, Omicron has already peaked in San Francisco, officials say. A bill would allow those 12 and up to get any vaccine without consent, and John does have that story amongst others. Thank you for the notice, Scott. From the Los Angeles Times, coronavirus transmission rates falling across California. From the Los Angeles Daily News, Los Angeles County posts 102 coronavirus fatalities on deadliest pandemic day since March. Isn't it interesting that from the Los Angeles Times, we have coronavirus transmission rates falling, and then right after it from the LA Daily News, Los Angeles County posts 102 coronavirus fatalities on deadliest pandemic day since March. What the heck is going on with that? Santa Rosa Press, 3 more COVID deaths reported as North Bay skilled nursing homes contend with virus spread. From Berkeley side, I don't remember ever having a news report on Work Comp Matters from Berkeley side, but here it is anyways. Omicron surge still rising in Berkeley, expected to peak by the end of January. What? Oh, yeah, by the end of January. That's next week, of course. Wow. From the Fresno Bee, Fresno hospitals delay surgeries amid COVID Omicron. From the San Francisco Chronicle, can you get infected with Omicron twice? Here's what the Bay Area experts say. And San Francisco Chronicle, UCSF scientists detect anomalies, thank you, anomalies in people with post-COVID brain fog. And I know John has that story. So just those, maybe a few more.
I'm going to say it. John has brain fog.
Say one more. Were you accusing me of having brain fog, John?
I said, I thought you were going to say John has continual brain fog.
No. If anybody has continual brain fog, it's me. It's probably one of the factors why I keep doing this damn show. anyways, that's enough from me. I'm going to turn it over to my co-host. For some reason, he keeps doing this show with me out in Munich, Germany, Mr. John Scalia. Take it away.
This is from the LA Times. California kids 12 and older could receive COVID-19 vaccine without parents' okay. Ani Chaglassian spent much of last year trying to convince her parents that she should be vaccinated against COVID-19. The 17-year-old said she laid out research showing it would safely protect her from being infected or passing the virus to others. She pleaded, she reasoned, she created a slideshow presentation. But the teen said her parents remained hesitant and she remained unvaccinated. Under a bill introduced Thursday by a California lawmaker, Chaglassian and other children in the state would be allowed to make their own vaccination decisions. Senate Bill 866 by Senator Scott Wiener, Democrat, San Francisco, would permit children 12 and older to be vaccinated, including against COVID-19, without their parents' consent or knowledge. The bill is the first to be proposed this year by a group of Democratic lawmakers that has pledged to strengthen vaccination laws and target misinformation amid the COVID-19 pandemic. The bill is certain to set off a feverish debate, all too familiar in Sacramento, overlapping with contentious issues surrounding a parent's right to make medical decisions for their children and a long inflamed battle over vaccine laws. I don't think there's any question that's going to happen, and we all know what everybody's going to say and on which side they are on. It's obvious why this legislation was introduced by Democratic legislators and apparently doesn't have any Republican co-sponsors because, as we all know, they believe parents are in place of God, and therefore they should make medical decisions regarding their children. But in reality, parents do have an obligation to make plenty of decisions for their children. So you can't just blanketly say, at a certain age, kids don't have to do what anything their parents want. That's not reasonable either. So it's an interesting balancing act, but it's a public health issue. And the question is on public health, should parents have the final say as opposed to public health authorities? Steve.
Well, yeah, and John, you raised very good questions. And I'm going to ask you this because you know me, I like to keep it simple, sometimes too simple. First question, are kids 12 and older allowed to get vaccines for smallpox, polio, measles, mumps, chickenpox without their parents' permission? If you know, yes or no?
I believe they do. Yeah, the article went on further to list the number of vaccines that they can already get without parents' permission. I think those are the ones.
Oh, I didn't know that. I didn't know that. Okay. Well, that is good to know. Let's see. Patient beware. Some states still pushing ineffective COVID antibody treatments. The top 12 states using antibody therapies produced by Regeneron and Lilly, which research shows don't work against the Omicron variant, include several southern states with some of the nation's lowest vaccination rates, but also California, which ranks among the top 20 for fully vaccinated residents. John.
Okay, this is from the San Francisco Chronicle, and the head begins with UCSF, and again, because that's in San Francisco, let me reiterate, that stands for University of California, San Francisco, and it's actually the medical school for Berkeley. Okay, so it's not called UC Berkeley because it's physically located in San Francisco, but it's actually part of UC Berkeley. UC San Francisco scientists detect anomalies in people with post-COVID brain fog. Scientists studying the persistent, quote, brain fog, unquote, that plagues many people after a bout with COVID-19 are reporting for the first time abnormalities in the clear liquid surrounding the brain and spinal cord of several patients. The discovery of elevated protein levels in the cerebrospinal fluid suggests the presence of inflammation, while unexpected antibodies may reveal an abnormally activated immune system, according to a small study, and that's going to become important later on, led by UCSF and published Tuesday in the journal Annals of Clinical and Translational neurology. And again, as a side note, I would point out that in almost every ranking of med schools, UCSF is in the top 5 in the country. It's possible that the immune system stimulated by the virus may be functioning in an unintended pathological way, even though the virus was no longer present, said Dr. Joanna Helmuth, a brain expert at UCSF's coronavirus's neurocognitive study and the study's senior author. Overall, the abnormalities also provide evidence to support what such patients have been insisting since the pandemic began, that their debilitating post-COVID cognitive problems are real, not a matter of being tired or stressed, say the study's authors. And so it goes on. So the point is they've detected these abnormalities. Now, there was a caution later on in the article that pointed out it's a very small scale study. And obviously small scale studies cannot be relied upon as a general finding. But there's nothing to contradict it. And I assume there will be larger scale studies done. And as Steve undoubtedly knows, cerebrospinal fluid is you may know it as the rock group Spinal Tap, which cerebrospinal fluid is what they tap out of your spine to detect abnormalities in your brain. Steve.
And John, what blows me away from a housekeeping point of view, and again, I kind of flubbed it when I was doing the opening, is that in the title of the story, the word is anomaly, which if I understand correctly, means something out of, it's a rare occurrence, an anomaly. However, the story uses the word abnormality 3 times, which means not normal. And the story itself never uses the word anomaly. So they're very close. They're somewhat synonymous, but they do have different meanings. That's just from a podcasting point of view. Okay. So I'm going to continue on after that very, very short and probably useless piece of information regarding the English language. Let's see what we have coming up next. See, I had to go down and then I blew it. Okay. From Santa Rosa Press, Democrat, 3 more COVID deaths reported as North Bay skilled nursing homes contend with virus spread. COVID-19 deaths are on the rise in January after 2 months of relatively low pandemic-related fatalities in Sonoma County. Local health officials reported 3 deaths on Wednesday, bringing the total number of COVID deaths to 429 since the pandemic began nearly 2 years ago. All 3 county residents were over 70 years old and all had underlying health conditions. And just as a short PS, Los Angeles, I think we're up at about 28,000 deaths. And since the pandemic started, and in the United States, we're right around 800,000. John.
And this is from the Capital Weekly. I'm not really sure what that is, but anyway, that's the source. Nurses confront state hospitals over COVID healthcare hazards. On the front line of healthcare during the COVID-19 pandemic, registered nurse members of the California Nurses Association / National Nurses United are pushing for more employer accountability tied to a crisis of staffing and unsafe workplaces. That's kind of like up our alley, huh, Steve? In particular, the CNA / NNU wants optimal workplace protections. The union, which represents about 100,000 registered nurses in California, says the California Department of Public Health has not adopted such workplace protections. The California Department of Public Health, noting the, quote, critical staffing shortages currently being experienced across the healthcare continuum, said healthcare providers, HCPs, who have been exposed and are asymptomatic may return to work immediately without quarantine and without testing. These HCPs must wear an N95 respirator for source control. Our workforce challenges are a national emergency that demands immediate attention. Zenai Triunfu Cortez. The CDPH workplace guidelines followed the Centers for Disease Control and Prevention's shortening of the quarantine period late last month. But NNU President Zene Cortez, RN, is skeptical of the CDHP's position. And it goes on. And of course, we all know that what's happening here is you've got a reality of shortage of workers conflicting with what would be the optimal public health guidelines. And what makes it even stranger is that these particular workers are all in public health and they're public health care workers. So what do? Well, it appears that, right now, expediency has taken over caution and they've just decided, well, we need these people at work. So, precautions be damned. We're going to go ahead, damn the torpedoes, full speed ahead. And I've got to admit, I pretty much sympathize with what the nurses are saying. Steve.
Yeah. Speaking of healthcare, hospitals in the central San Joaquin Valley are feeling the crush of overwhelmed emergency rooms so much that some of them have begun to stave, S-T-A-V-E, stave off non-emergency surgeries while they deal with COVID-19's Omicron variant, on top of the record-breaking number of COVID-19 patients entering hospitals. Many staffers are out because they have also contracted the highly infectious Omicron variant, hospital officials say. John.
Okay, this is from CBS News. And scammers are selling bogus COVID-19 tests. Here's how to avoid fakes. With home COVID-19 tests at the top of Americans' shopping lists as the Omicron variant continues to spread, scammers are trying to cash by taking advantage of unsuspecting consumers. Now, a little parenthetical aside here. I've got to, I have a slight laugh here because I get Social Security. Obviously, I'm 75. And of course, my Social Security notices come warning me about scammers because, as we all know, we old people are gullible and idiots, and we all go ahead with the scammers. So I always have a little chuckle. I always think of my mother, and honest to God, you couldn't scam my mother out of $1 unless you put a gun in her head. In fact, one guy did steal her purse, and she ripped it. She tried to rip it back, and my mom was tiny. Earlier this month, the Federal Trade Commission warned that online criminals are posing as legitimate sellers of over-the-counter COVID-19 testing kits. Quote, unauthorized at-home testing kits are popping up online as opportunistic scammers take advantage of the spike in demand, the agency said. The scams can take different forms. Some fraudsters pretending to be genuine merchants are hawking unauthorized rapid tests, while others have no merchandise on hand and just want to take your money and run. It's definitely happening, and it's really challenging, depending on the sophistication of the scam, for the consumer to discern this, said Gigi Giovanval, senior scholar at the Johns Hopkins Center for Health Security. Senators Ed Markey and Richard Blumenthal, that's the US senators, are calling on the FTC to investigate reports of price gouging and other illegal practices surrounding the sale of over-the-counter at-home COVID-19 test kits. Yeah, once again, what's the old saying? Something seems too good to be true.
Yeah,
probably.
Exactly. And by the way, even if you get the legitimate ones, which the Biden administration is sending out, you do the test, you send it out. Your results aren't going to be mailed back for 7 to 12 days, which means by the time you get it back, you may be over and done with it. Who knows? But from the Los Angeles Times, dealing with burnout. As frontline healthcare workers continue to be spread thin by the pandemic and high numbers of COVID-19 hospitalizations, 4 California healthcare organizations will receive a combined $8.7 million in federal funding to combat burnout and promote mental health among staffers in an attempt to curb attrition. The Health Resources and Services Administration awarded Children's Hospital Los Angeles, Samuel Merritt University in Oakland, Touro University in Vallejo, and the San Diego-based San Ysidro Health System with the grants, which will be distributed over 3 years. John, I'd be willing to bet $1 that a majority of that money does not go to staff burnout. It gets funneled and squeezed, and I don't know, maybe for new coffee cups or something. I don't know. Go ahead, John.
I'd be willing to bet that it doesn't produce anything worthwhile, regardless. Yeah. I mean, America believes in burning people out anyway. I mean, it's kind of like the credo of American capitalism.
Yeah.
Burn out and die at your desk. I mean, that seems to be the motto.
Yeah.
Okay. From the Bay Area News Group, Oakland Teachers Union threatens to strike if district doesn't reach new COVID agreement. The president of Oakland Unified School District's Teachers Union has given the district 48 hours. Wow, that's actually pretty short to come to an agreement about an updated COVID safety plan for schools across the district, saying that without an agreement, the union will vote on whether to strike. In an email to union members, Oakland Educators Association President Keith Brown said that 72% of OEA members voted yes to participate in a strike if their bargaining demands aren't met. Tonight, the OEA Executive Board voted to empower me to proceed with an all-member formal strike authorization vote in the event that Oakland Unified School District does not reach an agreement with us in the next 48 hours, Brown wrote. OEA's core demands include weekly testing at all schools, high-quality masks for all students and staff, and to address the staffing shortage at schools. That sounds familiar, doesn't it? By, quote, making sure there's an adult covering every classroom vacancy, close quote, according to Brown. Brown said there's been recent progress with better access to masks, extended COVID sick leave for employees, and covered outdoor eating spaces. But when the OEA originally asked for weekly testing in their proposal, he said the school board changed it to biweekly testing in an amended resolution passed during the fall. The progress was slow, Brown said. The district did not have a sense of urgency around the negotiations, and it's unfortunate that it took an Omicron surge and took student protests and grassroots teacher activism to push the district to meet with us and also to bring an agreement around COVID leave. Basically, this is labor management relations. And it's basically now, because there's such a shortage of employees, obviously, there's everywhere. This has given new strength and new impetus to the people who are organized in unions to bargain with the employers, which they didn't have before this all happened. But, if there had been something reasonable going on in the interim, this might not have ever come to pass. Steve.
Campuses in the Los Angeles School District have lower coronavirus rates and improved attendance in their second week since returning from winter break. But infections remain near record levels, and the extent of exposure to the virus at school is difficult to determine because health officials have temporarily abandoned contact tracing, calling it too burdensome to mandate during the explosive surge. Senior administrators said they are encouraged by the numbers, which come amid signs that cases from the Omicron variant could be peaking. Now, let's take this story for what it's worth. You want to do contact tracing for kids in K through 12. Now I'll be willing to bet $1 that any kids that contracted COVID in K through 12, they got it through another kid in the same school. What do you think, John?
That's clearly the most likely method of transmission. As I said, I represented the LA Unified School District for a long time, and diseases transmitted from students to teachers are probably the most common health hazard faced by teachers. I mean, that's just a fact, because part of it is that, as came out during the beginning of this whole pandemic, obviously in the beginning, kids were hardly getting sick at all, right? Remember that? And that's typical for children. There's a reason that children grow into adults. they have a lot more immunity as kids to most things, okay? And so,
yeah.
And when they're sick even, the symptoms are very mild for them, and they can be very significant for the adults around them, which basically are their parents and their teachers. And that's a common means of transmission. And probably, if you're a school teacher, it's probably, even in normal times, the biggest health hazard you face.
Yeah, and I've heard a lot of stories, a lot of people that I know, friends, colleagues, family, where not one, not two, but the whole household is getting COVID basically at the same time. You think it's because the kids are now in school, And now the kid is coming home to a whole household and he's infecting the entire household. Please remember that when we talk about cold and flu season in like October, November, this is not because of the weather. This is because after being separated from kids from summer vacation, they all go back to school. All the kids get together. They're together 6-8 hours a day. And then the kids go home and they infect everybody in the household. It's not that difficult a concept.
No, and you and I both have kids and had them. Yeah, and we had them when they were little. And there's one thing that people tend to forget about this, and that is, like if you and your wife get sick, you agreed to limit your physical contact because you're adults and you know about it. And you say, okay, sweetheart, as much as possible, we're going to stay away from each other until we get over this thing, right? You never do that with your kids. I mean, your kids are sick. You never tell a kid, I can't hug you because you're sick. Of course not. I mean, I don't know. I'm sure you did the same thing. You always, you don't stop hugging your kids just because they have a virus. And so, yes, it's quite likely you're going to get it too. I mean, I always joke the most efficient germ transmission mechanism was called a family.
Yeah, exactly. And not only do we hug the kids, but we give the kids kisses on the cheek. They give us kisses on the cheek. We touch our face. Then we touch common areas. Not that difficult a concept. Go ahead, John.
Capistrano School District struggles to get substitute teachers during Omicron wave. Capistrano, this is in Orange County, by the way, Capistrano Unified School District officials are scrambling to get substitute teachers during Orange County's fourth COVID surge, which is causing staff shortages throughout the country. At Wednesday's meeting, Capistrano Unified trustees unanimously passed a resolution stating their temporary staffing needs amid the Omicron surge, which enables officials to use Governor Gavin Newsom's executive order that makes it easier for districts to hire substitute teachers in an effort to keep classrooms open. Between the time period of January 3 and January 12, the instructional programs operated by the district had a need to fill, are you ready for this, 2,064 substitute teaching assignments for in-person instruction at an average of 258 assignments per day for 8 working days, reads the staff report. Due to extreme substitute shortages caused by the Omicron-driven rise in COVID-19 cases, the instructional programs were unable to fill daily substitute assignments at an average of 22% per instructional day. It's not surprising. It's happening all over. One of my good friends who lives in San Diego County is really a smart guy, but as a pastime, he's also on the substitute teacher list in San Diego, and he's got comorbidity, so he avoids stuff right now. But he's been inactive on that list, and he never gets off of it because they're so desperate for substitutes. He'll be on the list no matter, unless he sends him a pipe bomb, he'll be on that list forever. Steve.
John, we are at the end of the show. Any closing thoughts, burning desires?
No, but stay tuned in 15 minutes for Jameson and my show on sports, and I probably will get my little spiel in on the decision on Novak Djokovic and why I think the court they came to the right result with a terrible decision. So stay tuned for that for Father and Son on Sports.
Gotta love it. And thank you, everybody, for joining another edition of Work Comp Matters. We're brought to you by mancavepodcasting.com. If you want to do your own show, 818-357-4120. We will manage, produce, direct, stream it live, get it into the cloud forever. And if you're a little shy, you just want to listen, over 600 shows available for you 24/7. Got to thank Scott Walton of legendary Uncle Studio, John Scalia out in Munich, Germany, all the good people back at mancavepodcasting.com. My name's Steve Appel. We'll see you again Monday, live, 12 noon. Another edition of WorkCom Matters. Take care, everybody. Bye.